Hello and welcome. Today we're diving into the world of neurological conditions to explore provisional tic disorder. This is a condition characterized by involuntary movements and vocalizations, and understanding it is crucial for early identification and support. While the exact cause of provisional tic disorder remains elusive, research suggests a complex interplay of factors. Genetic predisposition plays a significant role, meaning individuals with a family history of tic disorders are more likely to develop them. Environmental factors, such as stress, anxiety, and even certain infections, may also contribute to the onset or exacerbation of tics. It's important to remember that provisional tic disorder is not caused by anything the child or their parents did wrong. The pathophysiology of provisional tic disorder is linked to dysfunction in specific brain circuits, particularly those involving the basal ganglia, thalamus, and cerebral cortex. These areas are responsible for controlling movement, habit formation, and impulse control. Imbalances in neurotransmitters, such as dopamine, are believed to disrupt these circuits, leading to the involuntary movements and vocalizations that characterize tics. Determining the precise epidemiology of provisional tic disorder can be challenging, as many cases may go undiagnosed, especially when tics are mild. Studies estimate that provisional tic disorder affects a significant number of children, particularly during the early school years. It is considered more common than more persistent tic disorders like Tourette syndrome, with some studies suggesting that a notable percentage of children may experience provisional tics at some point in their development. The hallmark of provisional tic disorder is the presence of tics. These can manifest as motor tics, involving physical movements like eye blinking, head jerking, or shoulder shrugging. Vocal tics, on the other hand, involve sounds such as throat clearing, sniffing, or grunting. The specific types of tics and their severity can vary greatly from person to person. To meet the diagnostic criteria for provisional tic disorder, tics must be present for less than 12 months. Diagnosing provisional tic disorder typically involves a clinical evaluation by a qualified healthcare professional, such as a pediatrician, neurologist, or psychiatrist. This evaluation includes a detailed medical history, a neurological examination, an observation of the individual's behavior. It is essential to rule out other medical conditions that may cause similar symptoms, such as medication side effects or other neurological disorders. A key factor in diagnosis is that the tics must have been present for less than a year. Unlike some other tic disorders, provisional tic disorder doesn't have subtypes based on tic type, since the definition simply states the existence of either motor or phonic vocal tics, or both for less than 12 months. The primary goal of treatment for provisional tic disorder is to manage symptoms and improve the individual's quality of life. In many cases, mild tics may not require any specific treatment, as they often resolve on their own. However, if tics are causing significant distress or interfering with daily activities, behavioral therapies, such as comprehensive behavioral intervention for tics or CBIT, can be helpful. CBI focuses on teaching individuals strategies to become more aware of their tics and develop competing responses to suppress them. In some cases, medication may be considered to reduce tic frequency and severity, although this is typically reserved for more severe cases. Currently, there is no known way to completely prevent provisional tic disorder. However, managing contributing factors like stress and anxiety can be helpful. Creating a supportive and understanding environment for children who are experiencing tics is crucial. Early identification and intervention can also help prevent tics from becoming more persistent or severe. The prognosis for provisional tic disorder is generally good. In many cases, tics resolve spontaneously within a few months. However, some individuals may go on to develop more persistent tic disorders, such as Tourette syndrome. Ongoing research is exploring the underlying mechanisms of tic disorders and developing new and more effective treatments. Advances in neuroimaging techniques are helping scientists better understand the brain circuits involved in tic generation, which could lead to targeted therapies in the future.